Hello. So welcome to the MedRepo Clinic Access Portal. For the meantime, we only have um, a portal for the pharmacist, and to use it to ensure that only pharmacists actually use this, we have designed in such a way that it takes in your PCN verification number and confirms that the person is registered with PCN before they can open an account. So once they've registered and they put in their personal details, they put in their workplace and professional information, then they get to sign in. And when you sign in with your email. So in this case, use mine. And once you sign in to the account, you can see your dashboard here. You can track certain data like your DURs, medication dispensed in the last 30 days, and the test still updated because it's possible for the pharmacists and doctors and nurses to request a test from the lab. It's also possible that when the patient goes to a community pharmacy, they run a point of care test like checking their BP, blood sugar, and update it so that these are all the information that we want each member of the multidisciplinary medical team to have access to and to see. So for a pharmacist now, when you come in, you could always just access a patient's data from the patient's tab, and then right here we'll search for a patient's. So this is our patient, appointment Emmanuel, the software developer. So once we open a patient's profile, we can see their bio data, we can see their background, whether they have any family history, whether they have any chronic condition and allergies that we can see with appointment manual. Now there is this. We can also see the point of care tests that the patient has tested. All these are demo information for the patient, and each of this information will only be available based on what the patient wants the medical professional to see. It's not, it's completely limited to what the patient wants the medical professional to see. And that's why it's in their control. At the same time, it's everything that the medical professional needs to make a well-informed decision about caring for the patient. And as a pharmacist, you can review the patient's drug. You cannot just review the patient's drug, you can also request what we call a drug utilization review. Because the pharmacist, our job is to ensure that there are no drug related problems associated with the prescription that a patient is using. Now, considering these tools are designed to be used across all points of medical care in Nigeria, if a patient goes to a community pharmacy, that community pharmacy has the chance to actually take care of certain illnesses, maybe like malaria, maybe like typhoid, the patient goes to do tests and all. This is what relieves pressure from the secondary and tertiary medical institutions because all community pharmacies act like primary health care centers. So even though pharmacists are not legally allowed to raise prescriptions and all, because we want them to be able to track what the patient is using and all on the patient side, because as you can see in the patient drug history, there is a section where it shows adherence. When a patient is prescribed a drug and the drug is added to a patient's prescription, they get alerts on their mobile app that reminds them to take these drugs, thereby promoting adherence and all. And so once the patient takes the drug, it is expected of them to go back to the app and indicate that, yeah, I've taken my drug at this time based on the reminder that I got. And while we know that this will take some time to actually build a habit for all patients, this is a key data that can help doctors and pharmacists know why the drug is not working, particularly for like an hypertensive patient. Now, you are using maybe lisinopril with telmisartan, and no, sorry, you can use still an ARB and ACI. Okay, let's say I using telmisartan and amlodipine now. I mean, also over time that your blood pressure is not coming down. But if you have a habit of actually checking in with the app that you've taken your drug, we can know whether it's an adherence problem or it's not at a glance without even asking. Although we could always ask the patient that have you actually been consistent with your drugs and all. But at a glance, if a patient has a habit of using the application, we can know by just checking our patient information. And this is the main selling point of MedRepo. And then obviously we have the profile, everyone can check everything and see their drug use review. and then where the pharmacist can help the patient to generate a prescription, not a prescription in the sense of a prescription, but a prescription for conditions that pharmacists manage in a community pharmacy. Thank you very much. So this is the Pharmacist Portal. We're still working on the lab portal, and the doctor portal will also be active very soon. But this is going to be an ecosystem that has nodes across every discipline in the healthcare system, because we know that every discipline runs a certain form of private practice that helps relieve the pressure from the hospitals in Nigeria.